Let's continue now with Dr. David Shulkin, the former Secretary of Veterans Affairs and a practicing physician. Secretary Shulkin, good to see you tonight. Welcome.
Glad to see you.
What did you make of the video that the president posted this evening?
Well, it was certainly good to see the president speaking comfortably, generally looking well, but I sure would have liked to have seen some empathy in the way that he spoke. You know, 205,000 people who have had his same illness aren't with us today. And certainly a lot of families and a lot of people have suffered. And we didn't see any real empathy coming from the president about this. You know, when people who are famous get an illness, particularly the president of the United States, this is a teaching moment, Joshua. This is an ability to explain to others something about this illness. And, you know, here's what we know. This is an illness that spread through the air. This is an illness that, despite the testing that goes on in the White House, like nowhere else in the country, even with all those negative tests, we still saw a spreading event last Saturday. This is a virus that clearly can still spread outside. This was an outside event. And so you shouldn't be having events where there are lots of people together not wearing masks. And this was the opportunity for the president to share with the nation what we know about this virus, how to save lives, how to create something out of this illness that becomes a national strategy. We just didn't hear any of that.
Talk to us a little bit about where President Trump is being treated. The Walter Reed National Military Medical Center. What makes that different than, say, treating him at the White House? We're told that the president can get quite a high degree of care at the White House.
Yeah, the White House has a full medical unit, has every capability, but there's nothing like the president's unit at Walter Reed. When you go there, it's an entire floor devoted specifically to the president. It has about 6 rooms. It has the full capability of all hospital care, but also full intensive care right in that unit, so you wouldn't have to move if you had to. It has the kitchens. It has dining rooms, office space, and it really is an extraordinary unit. You saw the 10 physicians and nurses that came out who cared for the president. These are incredible people where you get care. And in fact, you know, most Americans who get coronavirus, now 7 million of them, don't get access to that type of care, that type of team, the types of medications that the president has access to. And so many Americans who are getting this virus are now wondering, how do I get that type of care?
Yeah, it's just one of the kind of remarkable things for people who have never been there. You know, Walter Reed sits right outside of Washington. It's basically across the street from the headquarters of the National Institutes of Health. It sits right next to the Uniformed Services University, which is basically a military medical school. There's a medical, dental, nursing, public health, allied professions school. So you're in the middle of this huge federal/military medical complex like nothing else on the planet. Also, the president is getting access to these treatments from Regeneron and getting treatment for remdesivir. What do you make of those two options, particularly since they're not fully approved, fully vetted for general use for everyday people?
Yeah, first of all, I couldn't agree with you more about Walter Reed. This is a real national center of excellence. And in fact, Walter Reed himself was the one who discovered about yellow fever, another virus. So it's pretty interesting that this is where the president's being treated for a virus. But in terms of the treatments that the president's receiving, both of these are relatively experimental treatments. Remdesivir, of course, has a emergency use authorization, but it's a new antiviral that was developed for Ebola, now being tested on COVID-19. But the Regeneron monoclonal antibody has really not been used widespread before. So this is really state of the art, and we're seeing how that works. But of course, you know, most Americans just don't have access to this type of care. And if we want everybody who suffers from this pandemic-induced virus to be able to get the type of care that the president and others of privilege are being able to receive.
Former VA Secretary Dr. David Shulkin. Secretary Shulkin, good talking to you tonight. Thank you.
Thank you, Joshua.